when Health Canada failed to remove a dangerous cardiac drug from the market, I resigned and blew the whistle, revealing Health Canada's reliance on biased expert opinion from doctors with strong ties to the drug industry.
This is your wake-up call.
This Guy's Garage. Like and subscribe.
As a former senior public servant turned truth teller on 2 occasions, one internal and one external, I joined Health Canada's Drug Regulation Unit in 1980 and led the unit from 1988 to 1992 as Canada's senior physician responsible for prescription drug regulation. That is, the authorizations allowing clinical trials and market approvals for prescription medicines in Canada. I enjoyed the worthwhile challenges of that work in that senior role, but I gradually began to realize that Health Canada's senior ranks at times put Canadian lives at risk needlessly to favor perceived political and industry advantage, contrary to the Food and Drugs Act, which is, of course, the Citizens' Bill of Safety Rights. During one such event in 1991, I helped win a federal court case to remove a senior Health Canada officer who was overruling serious safety decisions on life-threatening drugs. Within 6 months, the same director was reinstated by the department by a new process, and my senior position was deleted from the org chart. I prepared then to leave Health Canada, having won an international competition for a post at the World Health Organization. Such posts require our government's concurrence. Health Canada's Deputy Minister was happy to agree to my departure, but only in return for my silence in any future legal proceedings. I declined that gag order on safety and forfeited a career-saving dream job. Eventually, in 1996, when Health Canada failed to remove a dangerous cardiac drug from the market, I resigned and blew the whistle in a major CBC documentary revealing Health Canada's reliance on biased expert opinion from doctors with strong ties to the drug industry. That documentary prompted landmark work showing unequivocally that ties to industry do wrongly bias doctors' interpretation of pharmaceutical research, and as a result, guidelines to manage medical conflict of interest were upgraded internationally, including at FDA, but not at Health Canada. In the aftermath of my resignation, I was blacklisted and didn't work for nearly 4 years. Instead, I used my voice, along with allies, to serve the public interest, to ensure that citizens understood the extreme danger of a health department that, under the policy guise of deregulation, had turned off the alarm systems essential for the preservation of lives. By 1998, those efforts bore fruit. Alarm bells were ringing across the country with the exposure of multiple Health Canada mishaps, I suppose, but scandals truly. It came at great personal cost to our family, with the death of my mother in 1999 due to all the turmoil and stress that our family was subjected to. I'd like to spend a moment speaking briefly to the need for legislative change to the current legal practice. Certainly, both cultural and legislative change are required parts of the solution we seek. But to me, legislative change is the essential key to achieve respect for and protection of truth tellers requires, first and foremost, legislative change in the form of sanctions on retaliation against whistleblowers, just as Tom has said just now. Why do I say this? In my experience, we are dealing in Canada's public service with a pervasive long-standing adherence to the loyalty principle. By that I mean the deeply ingrained standard operating procedures of cover-up and deception that automatically deploy reflexively to protect the image of the minister and the government at all cost. Do whatever it takes to cover up to and including lying, sadly, even if that puts Canadian lives at risk. Seek and destroy the truth teller who
Sorry, Dr.
jeopardizes
Brill-Edwards, I have to ask you to
facade.
wrap up, please.
Yes, I am just about to do that. The deeply ingrained principle operates even at the very highest level. So what must we do? Only legislated sanctions applied overtly on high officials will do the two essential things. And here I stop. First, create a safe space for truth tellers, free of retaliation. And secondly, signal to all public servants an authentic new era of transparency and not just more blah, blah, blah. Thank you.
So I'm going to go to you, Ms. Brill-Edwards, because we know that the legislative changes are critical in C-290. But can you speak about the importance of the culture in the public service, and that needs to change, and some suggestions on that?
Yes, the main thrust of my concerns is exactly that the committee understand the nature of the public service and the many constraints under which public servants work on a daily basis. And what is really required is to realize that unless there are legislative sanctions on retaliation against speaking up, then whistleblowers are in jeopardy in a system that, in a broad sense, requires loyalty, requires adherence to an overall thrust, an overall quest of the public service to serve the government, and that's a part of our democracy. But where things go off the rails is when individuals within that system are undertaking actions or decisions that do not serve the public interest. And Joanna has mentioned that if we have a scenario where everyone feels compelled to get along and go along with the decisions that are being made, and if one speaks up against decisions that are either wrong or very questionable and put, for example, in the case of medicines, lives at risk, if there is that kind of pressure against speaking up, knowing that there's going to be retaliation, then we cannot expect people to do the right thing and speak up.
What is the greatest thing you have learned in the journey that took you before this committee today? And would you change anything from the journey you've gone on, and what would that be?
I think I've learned overall that integrity matters, that it's important for each of us to speak up lest others be harmed. When I was in the midst of the difficulties at Health Canada with senior people who were quite willing to let other people die, I really felt that it was probably time for me to leave. And I said to my mother, who had had a number of strokes because of all this stress, that I would leave not wanting to lose her in order to fight these battles. And her answer to me still rings in my ears. She said, "Michelle, if for one moment I thought that on my account you would fail to do the thing that you know to be the right thing to do, that surely would kill me." Those are my marching orders, and that's the lesson that stays with me throughout all of this. And I keep encouraging friends and neighbors and anyone who listen, speak up. Don't accept what you feel is not right.